Antimicrobial use and resistance have become vitally important topics across both human and animal health. In order for the dairy industry to respond to this growing concern, research is playing a big role in developing strategies to reduce antimicrobial use and to reduce the risk of antimicrobial resistance. So today we're talking again with Dr. Herman Barkema and a couple of his students to discuss his work in addressing antimicrobial use and resistance. So thank you again, Herman, for being here with us for our part 2 of the interview. And thank you again to Kayley and Antimicrobial for being with us again as well. So we'll just jump right into the questions. Herman, you are the science director of the Antimicrobial Resistance One Health Consortium. So can you talk a little bit about what is this group and who is involved?
Thank you for that question, Kira. So let's first look at antimicrobial resistance and why it is important. Mm-hmm. We see an increase in the resistance to antimicrobials, to antibiotics, all the time. It is really threatening a lot of people that have it, that have an infection right now, and to the point that a lot of people are the bugs that they have in their body are not susceptible anymore for the antibiotics that we have available, and we're talking here about huge numbers and quite an increase in infections. So that's the people part. And of course, yeah, the people are our consumers in the dairy industry. So it is logical that they also think that we should do something about that, so that bacteria in the environment that come from cows or any other livestock, that they carry as least antibiotic resistant bacteria as possible. Because let's make sure, that everybody understands, milk will not play a role in that. We pasteurize milk, only if it's non-pasteurized milk, then it could play a role in antimicrobial resistance in the people that, for instance, live in the cities. And unpasteurized milk should just not be consumed. We do pasteurize milk for a reason. But we also see in livestock problems with antimicrobial resistance. And not only in livestock, also in the farmers that have livestock. So, and we want to keep the right also to treat animals with antibiotics. So the finger, yes, is pointed at us, and most likely the biggest reason for antimicrobial resistance in humans is use in humans. But animals play a role in that. That's quite clear. We have done a study where we looked at, if you stop using antimicrobials, what is the effect on antimicrobial resistance, not only in animals, but also in the farmers and also in humans there who are the consumers and who don't touch or see those animals. So we took all the studies available on that, in total 171 studies, and 22 of those looked at the whole gamut from use in animals to people, and we found that there was a 21% reduction in humans, antimicrobial resistance in humans, if antimicrobials were not being used in animals. So we have a duty there. We need to understand that milk, rightfully so, is seen as a green product that is healthy, but we need to keep it that way, of course. So that is one of the reasons why we need to consider using less antimicrobials. So that is one of the reasons why we started this Antimicrobial Resistance One Health Consortium. So I brought all the researchers in Alberta together, 106 in total, who work on antimicrobial resistance. And we created 28 projects together and submitted that to the Ministry of Jobs, Economics and Innovation. And it was funded by that ministry. And so we have all these people now talking to each other, which is essential. We have human doctors, we have lawyers, because we also want to go to policy. We have economists, we have engineers, we have microbiologists, physiologists, all kind of people that work on projects together. And that is, so we have projects in beef cattle, we have projects in the environment, dairy cattle, a lot of projects in humans. How do you change prescription behavior, not only of human doctors, but also veterinarians? Because we see also in humans a lot of the viral infections are treated with antimicrobials. And we've seen this now with COVID-19, that antimicrobial resistance has become a big problem in COVID-19 patients. And so we also have a project in that area. So then we also do a lot of training. We have 85 trainees, graduate students, postdocs there. And we just finished a graduate course with 20 90-minute sessions for graduate students and postdocs, and the whole gamut, from human health, animal health, environmental health, and they all work together in these projects and learn to trust each other, which is also very important. Then we also do a lot of engagement with the public, telling us we need to show that we are doing well. In the dairy industry, for instance, and other livestock industries, that we care, that we work together with human doctors, and that we try to reduce the use of antibiotics wherever we can.
Great. Yeah, it sounds like a really important group to get together and doing, essential work, because it's a big topic, and you're right, it involves from top to bottom, people, animals, environment, everything. So it sounds very productive. So you've talked a little bit about what the consortium aims to achieve, but maybe we could get a little bit more into the dairy specific side of it. So what kind of projects are being done right now that are, more relevant to our dairy industry and our dairy producers?
So there are two projects, and the one is the project that was prescribed by Kayley in the previous session, and that is on selective dry cow treatment and selective treatment of clinical mastitis. So we are looking at what is the best way to implement it, what herds should do it, what cows should can we not use antibiotics at drying off, and also with clinical mastitis, the E. coli, Klebsiella, what we call the gram-negative bugs, they don't need treatment with antibiotics. They're not sensitive for it. So only the Staph aureus and the Klebsiella and the Streptococci, they need to be treated. So we're looking at a good way of doing that. So that is one, and also what farms should do that, and what farms should not even consider that, because the distribution of bacteria that you find in farms differs from farm to farm. So that's one project, and then we also have project on prescription behavior of veterinarians. So what herds or what veterinarians prescribe more antibiotics than others, and can we work together to see whether that can be decreased, yes or no?
Yeah, that sounds really good. So Kayley, I know you did describe it a little bit in our other interview, but just in case we have any listeners who are only listening to this one, could you briefly go into your project on selective versus dry cow treatments and what implications that has for antimicrobial use and resistance?
Yeah, so essentially what we're seeing is that since most antibiotic use on dairy farms is to either prevent or treat mastitis, and we've seen, such a shift in the dairy industry over the past 10 or so years of this has really given us an opportunity to reconsider certain aspects of dairy cattle management. And this includes, treatment of clinical mastitis and, blanket treating all cows at dry off. So there's a lot of literature suggesting that these techniques aren't necessary anymore. So what we're trying to do is get sort of contextually appropriate results that we can use to make suggestions to, Western Canadian or Canadian dairy producers on how to enact selective dry cow therapy and selective clinical mastitis treatments on their farms. So both at the herd level and the individual cow level. So we're doing that by evaluating the long-term impacts on the farms in general, so production parameters and health parameters, but also on the farm economics. So the producers can really see, is this a feasible option for me in my specific scenario?
And a lot of farmers have already moved to selective dry cow treatment.
Yes.
Yeah, because in the last study that we have done, and that was actually the next national dairy study that was led by Dr. Dave Kelton from the University of Guelph, 35% of the farms in Canada are already doing selective dry cow treatment. And so that is a huge increase from 10%, which it was 10 years ago, to 35% right now.
That's great. Yeah, I had no idea that it was increasing by so much. So that's really nice to hear. Something else you mentioned in our last interview was also the disease surveillance, the CHESS project. So could you touch a little bit about that again and why that kind of disease benchmarking and surveillance is so important in regards to antimicrobial use and resistance?
So in Canada, every year we get new diseases, but we have not eradicated an infectious disease in the last 50 years. So here we are now getting Salmonella Dublin in some provinces. We're getting, because of the change in temperature, global warming, we get other diseases with ticks also in the provinces. Fortunately, not yet in Alberta, but that may very well come. So it is really important that we start eradicating the disease that threaten the health of our dairy cattle. Of course, that needs to be done in a cost-effective way. And so economics of this are really important. But there are also some diseases that are a threat for the health of our farmers. I just was involved with a dairy herd that had a leptospirosis outbreak, where we had huge losses in the dairy cows, and also a lot of cows aborting and heifers aborting, and 3 days later the farmer got sick, and had to be hospitalized, and is at risk to being incapacitated for quite a period. So we need to be aware of those diseases and do something about it. And the same is true for diseases like Salmonella Dublin. We know, of course, with Jones, and that never has been completely proven, of course, but that, like Salmonella is a clear one. Crypto in calves, we get a lot of farmers' children that get sick of crypto, and there's quite a list of those diseases. So we need to think of that. Not that cows are typically healthy, but those things happen, and we need to be aware of it and do something about it. So we need control programs, but these programs need to be tested. First, we need to see what is the percentage of herds and the percentage of cows in herds that is affected. And then we need to check whether our control is effective, and secondly, whether it's cost effective. So that is where what we call the CHESS program is about. And we hope to implement that concurrently in the 4 Western provinces. Because the circumstances are, they are in a way different, but also quite similar in Western Canada. We typically have freestall the herds, and we have farmers that are, well educated and very good farmers. So we can implement those programs. So like I said, we really look at the cost effectiveness and also on how easy is it to implement. All of that will be done, of course, with the veterinary practitioners. They are essential for this, and we will do it together with the farmers because, as I have said often and over again, our research in our group is for the farmers, with the farmers.
Yeah, and I think that's something that our farmers really appreciate is the, practical approach that can be used on farm. And I also think it's important to consider, one of the strategies for reducing antimicrobial use is ideally reducing disease overall. So if we have a better understanding of the diseases that are on farm and how to manage them, that will contribute towards a reduction in antimicrobial use.
Exactly. And so we have seen that, for instance, now with the bulk tank somatic cell count going down and controlling mastitis. And now we are at a point that we can, in a lot of herds, start using less antibiotics with selective dry cow treatment and selective treatment of clinical mastitis. So yes, that is the case. The more healthy cows we have, the better it is for the farmers, and the better it also is economically.
Yeah, I definitely agree. So talking more about, stewardship for the responsible use of antimicrobials, based on the work in, your group and also this One Health Consortium, how would you say the dairy industry is performing right now?
The dairy industry is in general doing very well. We have good programs in place, but we now are at the point that we really need to look at antimicrobial stewardship. We have seen, like I mentioned, quite an increase of farms that are doing selective dry cow treatment, but they need help. So Lactanet stepped up by implementing this in their programs and helping the farmers to do that. And we're working, it's not only our group that works on this. Mm-hmm. We're very fortunate in Canada that the dairy researchers all work well together. And so we have people at the University of Prince Edward Island, University of Montreal in St. Hyacinthe, University of Guelph, and also the University of Saskatchewan that are all working together to help farmers doing this in the right way. So it is, we're part of a large group, and most of us are also in the mastitis network, which is also funded and has been funded all the time by the dairy industry. So it is a pleasure actually to work in Canada and do research on these things together.
So this might be a difficult question, but do you have any recommendations for our dairy producers? Maybe it's not specifically what they do on farm, but just in general, how they think about antimicrobial use?
Farmers, having the selective dry cow treatment in place was always a nice safety net to control these infections. that is in a lot of farms not necessary anymore. We need to play our part in the battle against antimicrobial resistance. Yes, also to protect the humans, and that's not only the folks in the cities, but also your own families and your workers. And then also we need to make sure that the human health sector cannot point a finger at us, because we want to keep the right to use antibiotics. When cows are sick and they need antibiotics, we want to be able to treat them. But then, of course, the best way to prevent the use of antimicrobials is to prevent infections. So the better we do management-wise, and to prevent infection, and that can be during milking, maintenance of the milking machine, the housing, name it, the less antibiotics we need. And one aspect in that is buying cows. We still have quite some herds that buy cows, often from an unknown origin. I've said this often, diseases are bought and paid for. So if you buy cows, you don't know what diseases they bring in the herd. So please, be careful with that. Do it as least as possible.
And I guess maybe that's a good point now to touch a little bit on biosecurity. It's recently been rolled out in ProAction, and there's been kind of mixed reviews on it, but maybe you could just briefly touch on biosecurity and why that's also important and ties into this whole conversation.
So first, I am so glad that there is a ProAction initiative. It is amazing that the farmers from all over Canada, all 10 provinces with a dairy industry, got together and rolled out the same program. And the word ProAction already says it. It is proactive, not reactive. We need to realize that, it's not only important that we produce milk the right way, but also that we can prove that we produce milk the right way. And that is what ProAction does. It improves certain circumstances at our dairy farms, but it also makes it visible that we do it the right way in the dairy industry. Therefore, I would say 95% of the farms, it is not that much work to implement ProAction. Of course, farmers are very independent, and like veterinarians are, and also researchers. But we need to realize that we are part of a production chain, where we need to prove that this is an excellent way of showing how well we actually do, because we do very well. So biosecurity is one of the 6 modules in that. And I'm part of the technical committee on biosecurity, and one of the people that helped developing it. The discussions were very good with all the people on it, and I think for nearly all farms it is not that much work to implement it, and we can actually improve the biosecurity on our dairy farms. We don't tell farmers to do this or do that too much, but we ask them to write things down. How they do it. So yes, we need to realize, as dairy industry, we're all in this together. It is not everybody on his own, but we need to show all together that we are great.
Thank you for saying that, Herman. I think that's a really good description of why we have ProAction and the benefits behind it moving forward for the whole industry. So to wrap this up, is there anything that we missed in this discussion for antimicrobial use and resistance, or any other projects that we haven't talked about yet?
So one thing that we need to look at is not only that we are decreasing the use of antimicrobials, but we also need to have a good look what antimicrobials we're using. And so that will be part of the discussion in the future, that we are going to use the antimicrobials that are really should be reserved for use in humans less and less. It is not necessary to use certain antimicrobials in the dairy industry because we have good alternatives for those antimicrobials. So we have, there are 4 classes, and the highly critical antibiotics that we need for diseases like tuberculosis, for instance, they should be reserved for use in humans so that we don't get more resistance against these antimicrobials.
Sorry. Go ahead, Kayley.
Can I also mention the CADNet program? Can we cut this part out and then can I mention the CADNet program?
Yes, please. Yeah.
Okay. Another initiative that we should really mention at this time is a joint program across Canada that's currently in practice is the Canadian Dairy Network for Antimicrobial Stewardship and Resistance, in which Herman was part of developing, and I myself currently am the project manager for the Alberta portion of the research. My colleague Ellen DeYoung is the project manager for the BC portion. And what this program has really been developed for is to understand the current status of antimicrobial use and resistance in the dairy industry. So we don't really know what the current status is in Canada overall. There's some smaller studies that look at things at a certain time point, but really what we need is a large surveillance system to understand what is the current situation and then what is the situation moving forward. So if anything were to be enacted or antimicrobials were to be voluntarily decreased or anything sort of changed in the industry, we'd have a baseline for knowing what the resistance levels and the use levels are, and then we can see how that progresses in the future. So we're working together with all of the veterinary schools across Canada and some industry partners as well to really come together and work on this and see what the current status is and sort of how to approach the situation to benefit producers long term.
So is this a project, so it started, will this be, will farmers be seeing this on farm? Will you guys be out there? Like kind of what happens in terms of determining this baseline?
Yeah, so we've already been out on farms. It's really in the initial stages at the moment. So there's 30 study farms in each study region. So for example, 30 Alberta farms are participating in this program. So they really offer us the baseline information that we can use moving forward. So we look at antibiotic use and sort of antibiotic treatment records, and also we're taking samples to look at the current resistance levels in the bacteria we're finding on farm. So we've initiated that along with some producer questionnaires and sort of really trying to get an understanding of antimicrobial use status in Canada. And once that is sort of established further, what is intended is that this information will be given back to producers. So then the entire dairy industry will be more informed on what the current status is for the country. It won't just be for us working in our labs. It'll be information that will benefit producers and veterinarians as well. So that's the overall the end goal, I should say, of the program, is to really give this information back to the antimicrobial end users, which are the producers and the veterinarians.
And this project is again an excellent example of how we work together in Canada. It is led by Javier Sanchez, Dr. Javier Sanchez at University of Prince Edward Island, the Atlantic Vet College, together with Dave Leger, Dr. Dave Leger of the Public Health Agency of Canada, and we all worked in there together to develop it. And it became part of the Dairy Cluster 3 program, which is funded partly by Dairy Farmers of Canada and also Agriculture and Agri-Food Canada. So we have a couple of excellent projects in the dairy cluster 3, and this is one of them.
Yeah, and that sounds great. And I think, the talk that we've had today has really highlighted, the amount of cross-Canada work and even, across disciplines and not necessarily just within livestock. So it's great that kind of collaboration is occurring to tackle such a huge issue.
Exactly. And like with the AMR One Health Consortium, it is so great that we also within the province work together on these issues. Because the AMR One Health Consortium, we have researchers from University of Alberta, University of Calgary, University of Lethbridge, Lakeland College, Olds College, SAIT, Mount Royal University, and the research center, the Lethbridge Research Center of Agriculture and Agri-Food Canada. And we all work together on this. It is just great to see if you bring people together and that great things happen.
Well, thank you very much for your time today and for having this discussion with us. So I will certainly put your contact information out there if any of our producers have any questions. But yeah, thank you very much.